is my dummy account. All right. Okay. Hey, Divine. Sorry. I'll I'll probably start in a couple minutes. I'm just gonna wait for some folks to roll in. Otherwise, hope you've had a good day. Yeah, I'm trying my best to get it over to the YouTube side. By the way, do you hear any double, like feedback anywhere? Like, do you hear my other phone going off? Little echo? Okay. Just hope I can still record audio. Actually, let me stuff this somewhere no one can hear it. Okay, can you hear that? Oh, you might hear it. A little bit of an echo? Bring it down to that. Okay. I'm going to give us about 3 more minutes and I'll start my lecture. Otherwise, I hope you've been having a good day. Hi, Celeste. Thank you for joining. I'm going to be starting in around 3 minutes or so. Working and listening. Okay, that's fine, Divine. Yeah, and I'm glad you're here, Celeste. No, don't worry. I was gonna get started around in a couple minutes, so don't worry about it. Is the music too loud? I can always lower it down so you can hear me. Figure some Ghibli jazz would be nice. Have in the background. Okay, I'm glad. Okay. Get started here in 2 minutes. Be fair, I was a little late, but it's fine. Not the worst. I also gotta take my meds too. Good old iron pills. Okay. Oh, hang on. Okay. Alright, I'm gonna get started on my lecture. Ooh. You might hear my dog is in the background, but it's alright. Okay, so today's lesson. Today's lesson, we're gonna talk about kidney stones. So, what are kidney stones? Kidney stones are otherwise known as renal calculi, nephrolithiasis, nephrolithiasis, yeah, or urolithiasis, are hard deposits of made of minerals and salts formed in the kidneys. So, if you remember, if you were in my past lesson about gout yesterday, kidneys are responsible for a lot of the filtering you have in your body. They specifically take out excess salts, minerals, substances, electrolytes that you might consume over the course of your diet. So, knowing that, um, sometimes though, kidneys can't get it all. So, kidney stones develop when urine contains high levels of certain substances such as calcium, oxalate, uric acid, or phosphate, and insufficient liquid to dissolve them. So, the imbalance leads to crystal formation, which can grow into stones of varying sizes and shapes. So, there are a couple different kinds of kidney stones. Um, First are the calcium stones. Those are the most common, often composed of calcium oxalate or calcium phosphate. So that happens when you have too much calcium running in the body. Hi, Coffee Mom. What's up, my scrub? Thank you for coming in. Yeah, so I'm just starting my lecture on kidney stones. So, like I said, calcium stones are the most common. You usually get them from an excess of calcium intake. Um, Next over is the uric acid stones. They're formed due to high levels of uric acid in the urine, often associated with diet search and purines. So if you remember my lecture from yesterday, yeah, you can actually get quote unquote gout in your urinary tract. Yeah, and that really sucks. um, there's something called struvite stones. Yeah, it's pretty gnarly. There's something called struvite stones. It's less common and typically caused by urinary tract infections. So these are stones that are developed when you do get an infection of that tract, and unfortunately, it's as a part of the metabolism, part of the immune system response. Next is our cysteine stones. They're pretty rare and are linked to genetic disorders linked to cysteine metabolism. So we're not really going to go over that so much, simply because it's kind of rare. It's more of one of the common types. Hello, Loctera. Thank you for joining in. I am Riko Siempre RN, IRL nurse and VTuber RN educator. And today we're going to cover kidney stones. So I just started the lecture. We're just about to go over the symptoms of kidney stones. So, symptoms of kidney stones can vary depending on the size and location of the stone. Common symptoms include severe back, lower abdomen, side or groin pain. So, the pain may come in waves and fluctuate in intensity. It can be sharp and sudden, and often described as one of the most intense pains possible. So, you'll know you'll have a kidney stone because it's going to hurt like a mother lover. Yeah, you're going to feel it. You'll also notice some changes in urination. So, if you notice that your urine is pink, red, or brown, that's indicative of bleeding within the urinary tract. You would also, yeah, kidney stones can even make grown men cry. Well, even grown women would cry with it too. Other changes to urination you'll see is cloudy or foul-smelling urine, frequent urge to urinate, pain or burning sensation while urinating, and difficulty urinating or passing only small amounts. Hello, Random Zero. Thank you for joining the stream, and thank you so much for the star. Thank you. We're having a lesson on kidney stones. I'm Riko Siempre, RN, your IRL nurse and VTuber RN educator. So this is my lecture on kidney stones. Thank you for joining me. So we were just going over the symptoms of kidney stones. Yeah, I'm doing great today. I'm recovering from my ankle and foot being assaulted with gout, but it's starting to tide over. So I'll probably be good to work back on my floor tomorrow. All right, so other symptoms that you'll see with kidney stones are nausea and vomiting, fever and chills, especially if there's an infection present, and feeling sweaty. It is important to note that very small kidney stones may pass without causing any noticeable symptoms. However, larger stones can cause severe discomfort and may require medical intervention. If you experience persistent severe pain or any combination of these symptoms, you're going to need to see someone at the hospital. Or urgent care at the very least if it's not so bad. Hello, UA. Thank you for joining on the stream. And hey, Annika. Good to see you, sweetie. Thank you for joining. I'm Riko Siempre, RN, IRL nurse, and VTuber RN educator. And I'm here to give a lecture on kidney stones and why they hurt like a son of a bitch. So, how do we go about... So how long do stone symptoms typically last? So the duration of kidney stones can vary depending on the size and location of the stone, but typically they last anywhere from a few days to several weeks. So here's a breakdown of what to expect. Oh, did you just start, or did IRIAM fail to notify me? Maybe. It could be that IRIAM failed to notify you. I'm sorry. Hello, Ulrich610. Thank you for joining the stream for the first time. I'm Riko Siempre, RN, IRL nurse, and VTuber RN educator, and I'm having a lecture on kidney stones and why they hurt. Okay, so the duration of kidney stones can vary depending on the size and location of the stone. But like I said before, they can go from a few days to several weeks. So here's a breakdown. Small stones under 4 millimeters, these often pass within 1 or 2 weeks. Larger stones may take 2 or 3 weeks to pass completely. But overall duration, it can take up to 3 to 4 weeks for kidney stones to pass on their own. The pain associated with kidney stones can be intermittent or ongoing. So once the stone starts moving from the kidney to the ureter, pain can come in waves and fluctuate in intensity. This sporadic pain can last till the stone passes completely, which explains why symptoms may seem to come and go. Even after the stone reaches the bladder, it usually takes a few more days to pass. It's important to note that while the most severe pain may subside once the stone reaches the bladder, you might still experience discomfort or urinary symptoms until it's fully passed. So if you are experiencing those symptoms, please consult a healthcare provider. Don't consult me here on IRIAM. No, I am like I said in my profile, I posted any medical education here is not here for do not mistake it for medical advice. I'm here just to provide education and entertainment, nothing more. So take what you can for a grain of salt. But however, if it does empower you to see your provider, your doctor, or primary care provider, please do so. Okay. So how do we go about diagnosing this? So imaging tests such as CT scans or ultrasounds, urine tests to identify stone-forming substances, and blood tests to check for high levels of minerals. So, let's see here. Hi, Like Dark. Thank you for joining in. Seems you caught me in near the beginning of my lecture. Thanks for coming in, and thank you for sending the star. Thank you so much. So, let's see here. Well, that's a brief of it, but I'd like to tell y'all the long form of it. Trying to get my thing here. So, diagnosing kidney stones. Hello, stopping by while I can. Well, I appreciate it. Thank you very much. Any length of time is cool. I'm just glad you stopped by. Sit and watch, sit and hear. Too bad we can't just bash the kidney stones. Actually, if you stick long enough, we can actually tell you how treatments is done. So diagnosing kidney stones involves a combination of medical history, physical examination, and various tests. So here's a bit of an overview of the explodable. Kinda, sorta. You'll see what I mean. So here's an overview of the diagnostic process. So a healthcare professional will first ask you about your symptoms, medical history, and family history of kidney stones. So just be aware, there is a bit of a genetic component when it comes to kidney stones. Reason being, if your family member, I'm talking about something difficult. Yeah, it is. But at the same time, this is I'm trying to make it so that even a person off the street can understand it, because I hate to say it, it's There's a lot that goes into it, so I'm doing my best to make it so that you can understand. And if you have any questions at all, UA, or anybody else in chat, feel free to stop me and let me know what I can explain. Okay? So, um, where was I? Yes, medical history and physical examination. So, if you have had a family history of kidney stones, like say it came from, I'm sorry, I might get desperate about the translation. No, it's okay. It's okay. Just let me know if you need me to slow down or try to explain what I'm doing or what I'm trying to teach, and I don't mind because everybody deserves to know. So like I said, a healthcare professional will first do your intake. If you had a family history of it, unfortunately, there is a bit of a genetic component because if your family has history of kidney stones, you might also as well. Hate to say it. Imaging tests will be done. Like I said before, the CT scan is considered the gold standard for diagnosing kidney stones with a sensitivity of approximately 95%. It provides detailed images without using contrast medium. Ultrasound, usually done in the ER or in urgent care. It's often used as the initial imaging test, especially in, like I said, in emergency departments to avoid radiation exposure. It's been considered to have equivalent diagnostic accuracy to CT scans in emergency settings. Emphasis on emergency. Can't have family condition if you don't know them. Yeah, I know. I mean, if you don't know your family's health history, then it's kind of rough. But sometimes you just discover it along the way. Is age a factor when it comes to kidney stones? I will get there. I'll get there. Don't worry. Some other imaging tests that will be taken: an X-ray, useful for monitoring known stone disease and determining if a stone is suitable for shockwave treatment. This is the thing that Coffee Mom was mentioning before. Are there any different types of kidney stones, or are they just similar? So I did actually go over different kinds of kidney stones. The most common ones we're going to be going over are calcium stones and gout stones. Hi, Louis Sashimi. Thank you for dropping in. Thank you so much, and thank you for the star. Doing my lesson on kidney stones. There's also something called an intravenous pyelogram, which is a special X-ray of the urinary system taken after injecting a dye, only used in some cases. Some other tests we would perform are urinalysis, which detects blood in urine, crystals, and signs of urinary tract infection. A 24-hour urine collection, so it analyzes the urine composition over 24 hours to identify stone-forming substances and evaluate risk factors. And blood tests check for high levels of calcium, uric acid, and other minerals that can lead to stone formation. We can also assess kidney function and look for signs of infection. The most notable ones that we are looking for in terms of blood tests are BUN, creatinine, uric acid, and WBC count, because those are indicative of the body's reactions to a kidney stone. So once this kidney stone is passed and removed, it can be analyzed to determine its composition, what helps in planning future prevention strategies. Providers choose the most appropriate diagnostic methods based on the patient's symptoms, medical history, or individual circumstances. A combination of these tests allows for accurate diagnosis and guides treatment decisions for kidney stones. Yes, kidney stones are very painful. I'm pretty sure anyone who's had them can attest exactly how excruciating they are. It is not a joke. Here, since we asked about the age, prevalence of kidney stones due to age. So the prevalence of kidney stones do increase with age, but recent trends also showed some variations between men and women. So overall prevalence in the U.S. adult population is approximately 10%, or as I quoted in my tweet earlier. Let's see, it's about what? How many is that? Let me look that up real quick. Prevalence. I forgot the number. Actually, I posted it on my Twitter. What am I doing? I heard it's so painful that you can't move. Yes, actually, yeah. Kidney stones can be excruciating and debilitating, so you've got to be very careful about it. So be very aware if you have history of it or if your family has history of it, because you just very well may be affected by it. So just keep an eye out. Okay, yeah, here we go. 23.7 million Americans have been affected by it. Oh, I lost my thing. Okay. Um, so approximately 10% of the population of the United States. So I'm not going over how it affects globally, but just think of the United States as an indicator. So prevalence does increase with age for both sexes, but the patterns differ slightly. So within men, prevalence ranges from 2.7% in 20 to 29 year olds, and 16.9% in those 80 years old and older. With the highest prevalence found in men older than 80, and between men between 60 to 79 years old, it's about 18.8. Yeah, it does kind of suck to get old, but that's the way of the game. Your organs aren't working as well as they do. Um, so in women, um, they do. Here's a prevalence of 6.3% between the ages of 20 to 29, peaking at 11.5 from ages 60 to 69, then declining to 6.8 for those 80 years and older. So, but recent trends have showed an increasing trend among younger women. So it has increased from women's ages from 20 to 39, from 4.7 in 2007-2008 to 6.4% in recent years. So the gender gap in kidney stone prevalence appears to be narrowing, but male prevalence remains higher but stable, while prevalence in women shows a continuous increase. So, yep. Any theories as to why? Well, yeah, we'll actually go over that. Um, Monica says, my mom said she would rather go through labor again and is so traumatized by a massive one that one requires surgical removal that she is more concerned about preventing another one above all else. Yeah, I remember I was a bit of party of that. Yeah, yeah, I know. Yikes. Hi, Sheva. Thanks for joining in on the stream, and thank you for another streak, and thank you for the star. Okay. So peak incidence. Of when it appears between men and women is ages 40 to 49. However, you can also see them within ages 30 to 39, and 3.1% in women and in men, and 44% in women. So, why does this happen? So, kidney stones become more prevalent with age due to a combination of physiological, lifestyle, and health-related factors. There are some age-related changes in metabolism and physiology. Like I mentioned before, certified nephrology nurse, when your kidneys start to wind down, so does the function and filtering of it. Therefore, it won't be able to catch as much as those minerals and deposits as before. So as people age, kidney efficiency declines, which can lead to increased concentration of stone-forming substances like calcium, oxalate, and uric acid in the urine. There's also changes in urinary composition. Older adults may experience alterations in urinary pH and reduced citrate levels, both of which increase the likelihood of stone formation. So when you have less pH in your urine, or like less acid, it will cause the possibility of more stone formation, because unfortunately it is a combination of bicarbonate, calcium, all mixed together. Hi, little coffee cat. Thanks for joining in. No, you're not late. I'm just going over the prevalence of kidney stones due to age. Another factor. Yes, you were clearly here the whole time. So Another thing that causes more prevalence of kidney stones with age is comorbid conditions. Um, absolutely don't get totally absolutely don't get old 100%. If I had a kidney stone once, that was an you had a kidney stone once. Oh my god, that sucks. Oh wow. I don't blame you. It's yeah. Let's not get that. Yeah. No, I've been here. I hear that a lot. That a lot of people thought they were dying because of it. Yeah, it's not great. um, so, uh, but continuing on, the reason why you see more kidney stones in older people is that older individuals are more likely to have conditions such as obesity, diabetes, gout, and hyperparathyroidism, all which are risk factors for kidney stones. My college roommate. Hello, DUG59. What's up? Hey, what's up, my scrub? I'm Riko Siempre, RN, IRL nurse and VTuber RN educator, and I'm lecturing about kidney stones. Right now, I'm going over how age affects the prevalence of kidney stones. So, um, like I discussed before, how obesity, diabetes can also affect the formation of of uh, yeah of gout, uric acid content. So you're talking about kidney stones. Fun story. Yeah. It's a health education lecture. That's what I'm here for. hmm If you have any questions, let me know, and I'll be more than happy to answer them. So hyperparathyroidism. That's a bit of an interesting condition. It's when your parathyroid not. When I was born, I had a kidney stone. Oh my God! How? Well, to be fair, baby, um, coming right out of the, coming right from birth, the organs still need to get moving. So some things do need to start working. Is that possible? It's not without the. It's not with it. It's within the realm of possibility. So it could be that. Yeah, I can't say. I'm not. I hate to say it, but I am not an expert on babies, on the kids. Hate to say it. Mother Drake monsters on the daily. Jeez. Oh man, pre-order kidney stones. That's. Oh god. All right, let me continue. So, oh, thank you for the follow, DJ59. I appreciate that. So chronic condition. So hyperparathyroidism. So if you don't know what your parathyroids are, they are these little glands on top of your thyroid that help regulate the content of calcium and phosphorus within your body. So if you have too much parathyroid, sometimes you'll have too much calcium upon the body. Oh, Ari sent you. Oh, hey. Tell Erebus thank you so much if you get to see her again. Glands upon glands. Yes. Actually, your adrenal glands are right on top of your kidneys, believe it or not. And if you have something wrong with your kidneys, your adrenals also go too, believe it or not. So that's why we got to be careful with that as well. So if you have too much interesting. So if you do have hyperparathyroidism, the incidence of calculi or calcium within the blood and within the body is going to be higher. Other conditions, chronic conditions like renal tubular acidosis or recurrent urinary tract infections also contribute to stone formation in older adults. I'll make sure to give her a bonk and save us from you. I mean, feel free. I'll probably stop by and bonk her myself one of these days, if our streaming schedules don't line up one of these days. Medication use can also affect the prevalence of kidney stones. So a lot of older adults take medications such as diuretics or calcium supplements, which can alter urinary chemistry and increase the risk of stone formation. She needs it. Lifestyle factors as well. So dehydration is more common in older adults due to reduced thirst perception or limited mobility, leading to concentrated urine that promotes crystal formation. So when we ask you to hydrate, please do so, or you will dehydrate from pain. Especially if you're a young person, such as myself or anybody else in the streaming crowd. I know it's very important to make sure you keep yourself hydrated. That's why I have water here with me right now. Actually, I'm going to take a swig. Mm. Is homeostasis a joke to you? Absolutely yes. I feel that's the case between a lot of VTubers, streamers, whatever. They think they can mess with their kidneys, and this is what they get. One of these days, we're going to see a VTuber with a kidney stone on stream. It's going to suck. And I'm going to say I call it. So, other lifestyle factors, dietary habits such as high intake of sodium or animal protein and low calcium consumption may exacerbate the risk of stones in this age group. Oh, thank you for the let's go off guys skateboards, Celeste. Thank you so much. Hey Jay, thanks for joining in. That'd be great content though. I mean, yeah, it'd be. It's funny, haha. It's more like a funny, we laugh at them, uh-oh kind of moment, not a funny, oh, we're laughing together kind of deal. Yeah, yeah. hmm So, um, sorry, excuse me. Other factors include genetic predispositions, which I have mentioned before, and the gender differences. So, what can we do to treat kidney stones? So, treatment options for kidney stones depend on the size, location, and the type of stone. Here are some main approaches to treating them. So there is conservative management, which includes increasing your fluid intake to help pass small stones, some pain control medication, and alpha blockers to relax the ureter muscles and aid stone passage. So that means they want you to drink a lot of water, make sure you take some pain meds, and they're going to give you some other medications to help relax the ureter muscles. Meaning to say, you might be peeing more than you'd like, but it's better that you do rather than you don't. Percussive maintenance, ultrasound. Yeah, we're almost there. So I was actually going to talk about this. So here's our surgical interventions. So there is something called a shock wave lithotripsy, or SWL. So it uses sound waves to break stones into smaller fragments. It can be an outpatient procedure, but may require multiple sessions, and is suitable for smaller stones. So, I know, Coffee Mom, kaboom! So, if we want, we could have Celeste blast her set into the into the using the sound waves to break it down. It's destroy the stone with vibes. Yeah, we could. Hey, Castalico, thank you so much for joining the stream. The most powerful set ever breaking your stones. Yeah. So, hey, Castalico. So I'm. Hey! Thank you for the star. But yes, I am going over kidney stones and just to rock the stones out of existence. Oh man. Came to give my stars. Thank you so much. I appreciate that. I've been meaning to catch one of your streams sooner or later. I apologize. But I'm going to try my best to get to your next one. Okay. But yeah, today I'm going over kidney stones as my lecture for today. There's also something called uretoscopy, otherwise known as URS. Involves passing a small scope through the urinary tract. It allows for direct stone removal or laser fragmentation, and typically used for stones in the ureter or the kidney. So, that would include sometimes they would make a surgical incision and insert the scope from there. Other times I've heard that we've had to go through the urinary tract and scope all the way up from there from the urethra into the bladder, into the ureter that's been affected, even all the way to the kidneys if that's the case. There's also something called percutaneous nephrolithotomy, or PCNL. I had a kidney stone once. It was so painful they gave me morphine. It was not fun. Yes, it is not fun. It is extremely painful. Almost everyone I've heard who had it says it sucks so much. No, I don't blame you. It's absolutely horrifying and terrifying and painful. Shadow Huey, thank you so much for joining in on one of my streams again. I appreciate you, man. Or person. She. I don't know your pronouns. I'm so sorry. But yeah, well, welcome in. So percutaneous nephrolithotomy (PCNL) is the surgical removal of larger stones through a small incision in the back. It's the highest stone-free rate among surgical procedures, but it is a longer recovery time. But it can be done outpatient for some patients. Um, I do believe that Annika's mama had to have a surgery like that um, because of how big it was. There's also medication management. Uh, oh yeah, okay, yeah, I was right. So there's also medication management, potassium citrate to prevent stone growth recurrence, thiazide diuretics for recurrent calcium stones, and medications to alter urine composition based on stone type. So there are some prevention strategies that we can do. How to prevent? Let me grab my notes real quick. Is diet part of preventing them? Yes, actually. I'm actually gonna start going over that right now. Like certain foods or liquids, yeah, it can. Yeah. Hang on. Let me take another swig. Let's see. Annika's mama said she had multiple stones, but the worst one was almost 3 to 5 centimeters big. Oh my god! Not even breaking it up would let her pass it. Does this say what was the biggest stone they ever pulled out from a patient? You know what? Let me look that up for you. If I'm kind of curious myself. How large was the biggest kidney stone? I wonder if there's like a Guinness World Record. Oh my god. Largest kidney stone ever recorded was removed from a patient in Sri Lanka, measuring 5.26 inches, otherwise 13.372 centimeters long, and weighed 1.76 pounds, or 801 grams, breaking 2 world records. Jesus, tap dancing Christ. That sucks. It was removed from a 62-year-old retired soldier. Oh my god. The stone was removed using open pileolithotomy, which includes making an incision in the pelvis of the kidney. By God. Oh, wow. Hello, Pegasus. Thank you for joining on the stream. I'm Riko Siempre, RN. I'm the IRL nurse and VTuber RN educator, and I'm having a lecture on kidney stones. So we just found out what the largest kidney stone in the world. Apparently, it broke 2 world records with how long it was and how much it weighed at 5.62 inches and 1.76 pounds. Yeah, but yeah, they removed it using an open pileolithotomy, which is making an incision into the pelvis of the kidney. Real doctor? No, I am not a doctor. I'm a registered nurse, but a registered nurse can also educate too. Annika said that Annika's mama said she said losing her appendix and gallbladder were far easier to recover from. Ah, yes. Though, because I believe those were a lot less stressful on the body than it is with the kidney stone, because that, unfortunately, when it comes to excretion and waste management and urine production, that can't stop, because otherwise bad things can happen. Okay, back to preventing kidney stones. So, honestly, RNs do more teaching than most doctors I know. Yeah, I mean, doctors are very capable of teaching themselves, but at the same time, they have a heavy patient load. So, we do what we can if they can't, if they don't have the time to teach, so we will. To go on, to prevent, doctors are the busiest people around, apparently. Yeah, they can be. Yeah, they got a lot on their plate. Nurses too, but you know, we work together. They also don't translate the jargon. You know what? Sometimes nurses are guilty of that too. You know, it's not just a nurse-doctor distinction. It's that you happen to see the nurses more often because, you know, we're in charge of your care. So, you know, we need to orchestrate that. So we have our eyes and ears and everything. Oh yeah, yeah. You might hear my first son barking in the background there. Sorry about that. You know, he's being a little shit, but I love him. Okay, so to prevent kidney stones, you can follow these key strategies. So make sure you stay hydrated. You're trying to be diplomatic while on insurance or not. God. So in order to prevent kidney stones, you got to follow these key strategies. So make sure you stay hydrated. Um, for people who aren't affected by any kind of comorbidities, drink 2 to 3 liters of fluid a day, primarily water. This helps dilute urine and prevent stone formation. So notice that it's primarily water. Soft drinks, drinks with caffeine in them, sugary drinks, they may contribute to part of it, but it doesn't help dilute it. Riko and Dog Sunstream went, you know, one of these days. One of these days when he's out and about. Our other dog is out right now. So, like I said, make sure it's primarily water, not soft drinks, energy drinks, gamer subs, Celeste, or anything else that has like anything added because it doesn't add to it. Tea can be, sorry, but you look like Shota Aizawa. Sometimes I do, yeah. I do have these bags under my eyes in real life. Hides monster can't. I see you. I see you, honey. Tea can tea can also be contributory, specifically if it's caffeinated. Because remember, caffeine increases. It has a diuretic function. It's a feature, not a bug. So just be aware of that. So make sure you drink more water than you do anything else. Limit your sodium intake. So aim for less than 2,300 milligrams of sodium per day to reduce calcium excretion in the urine. So the thing is, the American diet, unfortunately, is very high in sodium. So please watch out for your sodium content. Other than water, is there any certain foods that can fight it as well? We're gonna go over that. So make sure you consume adequate dietary calcium. Eat calcium-rich foods like dairy products, but avoid excessive calcium supplements. So we also need to reduce animal protein consumption, limit meat, fish, and eggs to about 6 to 8 ounces per day, and moderate oxalate-rich foods. So if you're prone to calcium oxalate stones, limit foods high in oxalate, such as spinach, nuts, chocolate, and beets. So those two together, calcium and oxalate, are combined in the kidneys if you don't have enough water going to the body, or you're dehydrated, and unfortunately those stones can form. Let's see here. Increase your citrus intake. So consume lemon juice or other citrus fruits to increase citrate levels, which can help prevent stone formation. So if you like oranges, if you like limes, lemons, any citrus fruits, noted. I'm in for a fight for the future. Okay, so just I'm not saying that you should stop completely from having any of those foods. I'm just saying that you need to be sure you do so in moderation. Hi, Stray. Thanks for joining on the stream. Hello, True. Hi, True. Nice to see you. Thank you for sending in the star. I'm Riko Siempre, RN, IRL nurse, a VTuber, RN educator, and I'm going over kidney stones and how you can prevent them. I think you just rattled off all my favorite foods as bad. They're not bad. You just need to make sure you have it in moderation. So I'm not saying that at work, lurk, have fun, pal. Yeah, thank you. I appreciate that. Thank you for the lurk. So I'm not saying that you shouldn't have those anymore. Just make sure you have it in moderation. You know, all good things are in moderation. Like, yes, sugar is great. It's good for the body. You need it to process, metabolize its energy for your cells and for the rest of your body. But having too much can lead to diabetes. Half genuine, half joke. Can too much air be bad then? Kinda, yeah. I'm not gonna get too much into oxygenation dynamics because it's kind of unrelated. But if you are given 100% oxygen rather than 21% oxygen, you can cause too much oxygen in the body and actually cause what's called the what was it the free radicals in the body to go ahead and initiate because if you've ever heard of what was it antioxidants, we're trying to prevent the free radicals from reacting to the oxygen. So if you have too much oxygen, you can initiate the free radicals, and then you start the whole immune cascade, which is bad. So, Annika says, "Don't eat nothing but spinach, salad, and steak. I like chocolate fruit. Yeah, it makes your blood rust." I guess. But but no, I'm not saying that you can't not have it. What I'm saying is have it in moderation. Just don't have excessive amounts of it. So maintain a balanced diet, eat more fruits, vegetables, and whole grains. Avoid high doses of vitamin C supplements. Excess vitamin C can increase oxalate production. And consider your dietary changes based on the stone types. So your best advice, though, is to consult with your healthcare professional for personalized advice, probably your doctor, a registered dietitian, depending on the kind of stones you've been developing, or maybe prone to. Oxygen is a poison that takes a lifetime to kill. Technically, yes. What's this veggie table you speak of? What animal is that? Joking. But yeah. So, let's see here. I should go over the prevalence of kidney stones amongst ethnicities. That's why I only eat plants and eat the stuff for what they've done. I suppose so. Okay, so kidney stones amongst ethnicities. Let me take a swig real quick. I got your 4 basic food groups: beans, bacon, whiskey, and lard. I don't answer for that shit. So, the prevalence of kidney stones varies amongst different ethnic groups, with recent studies showing some notable trends. So, non-Hispanic white individuals, aka Caucasians, generally have the highest prevalence of kidney stones, with a study reporting with a rate of 52.5% of those affected by kidney stones being non-Hispanic white individuals. African Americans historically have had lower rates, but recent data has shown increasing prevalence. In South Carolina, specifically, it's a study within the state, showed black patients had an increase of 15% every 5 years from 1997 to 2012. And analysis of NIH data from 1994 to 2010 showed a substantial increase in stone prevalence amongst black patients. Yep. Hispanic individuals are also experiencing an increase in kidney stone prevalence, as noted by the same NIH analyses, comparing from 1994 data to 2007 to 2010 data. Asian populations show varying rates, with one study finding calcium oxalate stones more common in Asian and black populations compared to white British. Oh, that was a study done in Britain, okay? And regional differences also exist as well. Well, it also depends on diet, access to food, basically the social determinants of health, once again. Let's see here. Actually, let's go over that. Oh man, I'm Mexican. Well, that doesn't mean you'll have it. It just means that you may have a higher risk of it. Let's see, how do social determinants of health affect prevalence of kidney stones? Mexico, best to go. All right, so how do the social determinants of health affect prevalence of kidney stones? So, socioeconomic status. So lower socioeconomic status correlates with recurrent stone disease and worse outcomes. Crazy thought, let's eat the stones to fight the stones. No, Divine. That's not how this works. that your body's trying to get rid of it and you want to put it back in. That's not. HQ physician has thing to say. Kind of is. Like I said before, a lower socioeconomic status correlates with recurrent stone disease and worse outcomes. Individuals with state-assisted insurance have higher prevalence of kidney stones compared to those with private insurance, so 6.3% to 1.8%, because they have a limited access to care or funding for those insurance programs. Hello, Wayne. Thank you so much for joining the stream again. Thank you for the star. This is why my tummy always hurts. Not necessarily Pegasus. It's just why certain things happen with certain populations and certain risk factors. I didn't go to fish a stone out of the pea to eat it. Sorry, man. Hard pass. But Jesus. Paradoxically, though, some studies show a pro-rich distribution, with kidney stones being more common among wealthier individuals. I mean, I had to put like a pie graph correlation, but higher income is usually resulted in the more majority population. But take that as you will. That doesn't mean it's a causation. It's just a correlation. And remember, correlation does not equal causation. Okay. Lower education levels also affect the prevalence of kidney stones. So lower education levels are associated with advanced stone disease, with the odds ratio of being 1.91. Having a college education is the most protective against stones, compared to have less than a high school degree. Just use a strainer, Jesus. Yeah, we actually do have to give patients strainers when they're trying to pass stones. So we do need to try to collect a sample wherever we can. Believe it or not. Lower education may limit health literacy and affect understanding of symptoms and dietary habits. Profiling. Yeah, kind of. I wouldn't say so. Once again, my shitposts are somehow accurate. Yeah. You're not totally wrong. But yeah, it's but that's why for me, why I'm here on IRIAM and other platforms, is so that people have more access to education and have an understanding of the different things that could be affecting them. I'm telling you, I'm cursed with approximate knowledge of many things. But I'm using this platform so that way we can, be able to teach more, reach out more, and try to answer some questions. So, here I am. If you need me to explain anything more in depth, I'd be willing to. Thank you, bathroom reader. Okay, so income. Lower mean incomes are associated with advanced stone disease with an odds ratio of 2.38, and income significantly correlates with kidney stone prevalence. The best shit posts found in shit truths. Coffee Cat was obsessed. All right. We already went through race and ethnicity, neighborhoods, and built environments. Just a little coffee cat. I just aspire to be a modern Diogenes. Oh, I'm taking trazodone. I don't think trazodone really affects the prevalence of kidney stones, if I'm not mistaken, but I could be wrong. I gotta look that up though. So, along other social determinants of health that can relate to the prevalence of kidney stones, social distress scores, including factors like poverty levels and unemployment rates, correlate with lower urine potassium, which may affect stone formation. I have my drug guide. Okay, Annika, I would appreciate it. Access to healthcare. There are barriers to to access care, such as reduced trust in healthcare providers, limited insurance coverage, or increased work demands. They may lead to delayed diagnosis and treatment. So part of my outreach is to show that you can have more trust in your healthcare providers. Little Miss knows things, ooh woo. And geographic factors as well. Increased distance from referral centers is often associated with larger stone burden at presentation. So these findings are often highlight the complex interplay between social factors and kidney stone disease, and emphasize the need for targeted interventions and improved awareness among healthcare providers to address these disparities. She's smart, girl. Smartest IRX. Have I ever helped a patient with kidney stones? Yes, I have. So when a patient is considered end-stage renal disease, chronic kidney disease, that means their kidneys aren't functioning as well, or they're completely gone. Um, they're not working anymore. So, kidney stones can, in fact, appear even if they're still producing urine. And unfortunately, they can even appear even right in the kidneys, which can cause a lot of pain. Um, so, yes, I have worked with patients who've had kidney stones. Some of them were able to urinate them out, but because of the lower risk of but because of the lower kidney function, they won't be able to pee it out. So unfortunately, a lot of it comes down to surgical intervention or ultrasound intervention. Annika says, nope, no effect noted for stones from trazodone, and it recommends not taking with severe kidney impairment, and it can increase urinary frequency, but no mention of stones. So you should be fine with trazodone there, Pegasus. Mm. Okay, but yeah, I've had my fair share of patients who are ESRD, end-stage renal disease, and chronic kidney disease who've had kidney stones, and sometimes those kidney stones can actually affect um, affect the prevalence of kidney disease if left unchecked. So so imagine this: if you plug a pipe, if you clog it, where does that water go? It doesn't go anywhere, right? It just backs up everywhere. And next thing you know, the wastewater that you're trying to get rid of goes into the pipes that are trying to provide, um, trying to get rid of it. And next thing you know, it backs up into places where it shouldn't, and you're gonna have problems. Hello, Flippy Joe Star. Very nice to meet you. Thank you for joining the stream. Thank you for the star, and thank you for following me. I appreciate that. I'm Riko Siempre, RN. I'm the IRL nurse and VTuber RN educator, and I provide healthcare and nursing education on IRIAM and other platforms. Thank you for joining in. Hey, girl, where'd that water go? How about constipation? Um, usually there usually isn't any correlation between constipation and kidney stones. Those are those are I won't say those are usually fairly connected. However, there is one thing that can. It's your birthday. Well, happy birthday, Flippy Joe Star. I hope you have a wonderful day today. Um, so thank you so much for dropping in on your birthday. Happy birthday to you. I hope you have a really good one. Hoping you have a wonderful day. Hope you've had everything you wanted. And here's hoping you have a wonderful year ahead of you. Another year older, another year wiser. Hopefully, you'll be a little bit wiser after my lecture. Um, but yeah, when it comes to constipation and kidney stones, the only thing I can see that can be related factors are dehydration. So, when you're constipated, unfortunately, that means your GI tract has not absorbed enough water to help properly lubricate everything. Or say there's other problems with your diet or your GI tract, the smooth musculature. Um, but there's various other reasons to why constipation can happen. But the only connection I can see from kidney stones and constipation is lack of fluid intake. So, in order to prevent either of those, I would recommend making sure you have your 2 to 3 liters of water per day, maybe more if you need it. But just be wary. That depends on your other health problems, comorbidities, or anything that could affect fluid intake. But that's just general knowledge, not necessarily personalized to you. Okay. So I went over prevention, I went over prevalence, treatment, diagnoses. If there's anything else you would uh, like me to look over, or have any questions about what I've taught today on stream, you're more than welcome to ask. If you have any other suggestions of what other topics you want me to cover, I wouldn't mind taking them in right now. But yeah, I'll leave the floor open to chat, see if y'all have any questions for me, even if it doesn't have to do with kidney stones or anything else in particular. I wouldn't mind answering questions about myself, about my career, about anything at all, really. Or if there's like any stories you want me to tell or share, yeah, I don't mind. But yeah, the floor is yours, chat. I'm here for you. Oh, thank you for the star, Copycat. And thank you so much, Pegasus, for the follow. Hemochromostasis. Yeah, I guess I can cover that. Let me write that down real quick. Where's my piece of paper? Where'd you go? I just heard you. Ah, here we go. Hemochromatosis. The different colored eyes? I think that's called something else, but I will look that up. Hemochromostosis? I'll see what you mean. Usually when you say hemo, that relates to blood. If you're talking about heterochromia, that's a completely different thing. Wait, I'm done. That's my stupid blood disease. Oh, okay. Yeah. Okay, yeah. Chromatosis. Yeah, sure, I can talk about that. Sure, we can do that. Yeah. I can probably do a lecture on that. Just gotta make sure I study up and get my materials. But yeah, I don't mind. Sure, we can do that. I was thinking, like, man, the two different color eye thing, that's a genetic thing. Heterochromia. Yeah, that's it. Heterochromia. You're correct, Coffee Mom. Yeah, two different colored eyes, which I think is really cool. Yeah. I can cover hemochromatosis, in a different healthcare education lecture. So yeah, definitely. I'll make sure to make note of that. Anyone else have anything to share, or anything you want to talk about while you still have me? I don't mind just chatting either. La, da, 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 da. You learned a lot today. Well, I'm glad you did, Coffee Mom. I really did. That's the whole point when I have these health education lectures. I just want to make sure. Excuse me. I just want to make sure everybody has some knowledge going forward. Man, I wish some of these were easier to pronounce. Unfortunately, Greek and Latin be that way, and that's how we're identifying our diseases and calling our diseases. Annika did suggest I do a lecture one day about medical abbreviations and different names. I feel I'd like to hear you explain different white blood cells. That could be interesting. Oh, I could. So let's go over white blood cell differences one of these days, and I'll jot that down. We could learn about cells at work even. Yes, we could. God, I love this Cell at Work. I love that anime series. If you haven't watched Cells at Work, both the regular Cells at Work and Cells at Work Black, I would really encourage you all to watch it. We are working for you. Yes. Oh, Pegasus, you want to learn about asthma? Yeah, sure. We can cover asthma. So, I actually am affected by asthma myself. Had it ever since I was a kid. It hasn't affected me so much recently in my adult life, but sometimes it comes back to haunt me. Asthma, my other stupid disease. Oof. No, I feel you there. Don't definitely feel you there. But yeah, I can definitely cover asthma. Coffee Mom, that's not your fault. That's just how genetics and random chance works. You can't help it. It's not your fault. It's just the way life rolls. It's the way the dice rolls in life. Okay, that was one of my own dumb fault to be honest. Oh wow, not sure how that happened, but okay. Let's see. So hemochromatosis, white blood cell differences, asthma. Okay. Amano Miyaki, thank you for joining the stream for the first time. I'm Riko Siempre RN. I'm the IRL nurse and VTuber RN educator. I actually just finished my lecture on kidney stones today. Oh, hello. Hey, Sora. Thank you for joining on the stream. Hey, thank you. And thank you for sending the star. Thank you so much. What's up, my scrubs? What's up? so, unfortunately, I did just finish up my lecture on kidney stones. But if you have any questions about them, I'm very I'm very much willing to answer them if you have any. If not, I can always take suggestions for future lecture topics here for to teach on IRIAM. 888. Don't know what that means, but yeah. um, but yeah, if you have any suggestions or just want to chat, I'm cool. What one interesting method slash you learned during all these new medical practices? Um, so here's the thing. Um, I wouldn't say I'm on top of the newest and latest and greatest medical practices because when it comes to practice, nursing practice, medical practice, healthcare practice in general, we usually stick to what works unless we know from the research whatever new techniques or research can back it up. Um, it's Pachi Pachi Pachi, so like applause. Oh, okay, okay, yeah, okay. Sorry, I didn't know that one. Thank you, Abano. I really appreciate that. Getting hit in the kidneys is no joke too. Yeah, no, no. I remember getting punched in the kidneys once. It's pretty bad. Yeah, it hurt. It hurt. So I can only imagine a kidney stone. But yeah, um, so the thing is with learning any new methods in healthcare is that it first needs to be evidence based. We cannot use a new therapy or a new procedure unless we know for a fact that it works. And even then, we need a you know consent to for them to even be worked on. We need we need patients who are consented to the treatment, and anybody else who would want to um, be willing to be part of the procedure. Then, of course, they can always back out. Sora, thank you so much for the purple glow stick. I appreciate that. Thank you. Oh, sorry about that. My son's barking in the background. But yeah, so we really can't just. So anything new? Oh, thank you for the heart Pegasus. I appreciate that. Thank you so much. So anything new that happens to be out and about, or like bleeding edge, we probably won't be seeing ourselves on the floor unless we're connected to the research itself in general. Hello, Jasmine. Thank you for joining on the stream the first time. Thank you for the star. I'm Riko Siempre RN. I'm the IRL nurse and VTuber RN educator. I just actually wrapped up my lecture on kidney stones, but right now I'm taking questions, taking suggestions for future streams. But yeah, Annika says at least not until the FDA says to go do it. Yeah, yeah, exactly. Can't stay too long. Gotta work early. No, no, of course. Like if you decide to lurk, just drop in for a little bit. I don't mind, Sora. Thank you so much, and thank you so much for the glow stick again. Uh, remember, if you wanted to gift me anything, I totally appreciate that. However, I only ask that you only gift if you feel that you're financially able. I'm never gonna ask anything of you. To be a part of my streams. Knowledge is free. Anything that I share is free. As knowledge should be free. So if this helps you in your life, I just hope you'll be able to take care of yourself better in the future. So that's my adage. So don't gift me anything unless you feel like you want to. Then of course I will always appreciate it. But yeah, thank you so much, Sora, and thank you everybody else in chat. It's okay, I don't use real money. Well, I mean, the gifts do cost something, but if you're earning them from logging in from IRIAM and seeing other streamers, then that's cool too. Okay. I feel that I should wrap it up in a little bit. If anybody has any other questions or any other suggestions for topics to cover in the future, then I'd love to. Then more than willing to take it. If not, you can always. Hi, Lily Bull. Thank you for joining on the stream, and thank you for the streak. I'm actually about to wrap up my stream pretty soon. I just ended my lecture on kidney stones. Sorry about that. However, I know, I'm so sorry, Lily Bowl. But I hope that this screen recording I've had on my other phone will be working. I can upload the VOD so that way you can see what we talked about today on lecture. So I'll probably be uploading that on my YouTube channel. Good night. Thank you, Riko. Thank you so much, Coffee Mom. I appreciate that. So I'll probably be ending it here, but if you want to, thank you for the stream. Of course, anytime. Thank you, Divine Fox. Thank you for the skateboard. Thank you. Oh, hey, you got the star badge. Let's go. I'm happy. Thank you so much, Divine. um, so if you want to suggest anything, you just want to talk more about healthcare, or just even just talk to me just to hang out, I do have my Discord open. It is open to the public, so feel free to join in. I did share it on my Twitter account, and it's also listed on my profile. What wanted to wait but didn't want to do it during the talk? Of course, no, I appreciate Divine Fox. Thank you. So if you want to, oh, Celeste, you got a start badge 2. Oh my God, thank you. Oh, you're one of my scrubs now. Yeah, my personal love scrubs. Yeah, my personal scrubs. Thank you so much. Oh my God, thank you. But yeah, if you guys just want to chat, if you want to hang out with me on my Discord channel, feel free. It's posted on my Twitter. It's posted on my profile. Go ahead, join in if you'd like. No strings attached. I'd be happy if you decide to join in. If you don't, that's okay too. But if you want to contact me through Twitter, Blue Sky, any of my links on my link tree, I'd be more than willing to answer any questions that you have, or just be able to connect. So let me know. And I hope to see you all in the future. But thank you so much for coming to my lecture today, guys. I do appreciate that. I know I know sometimes these topics may seem a little dry, but at the same time, thank you for the lecture, of course. I know sometimes these topics may seem a little bit dry sometimes, but they affect millions of Americans and people all over the world. So it's good to know what you may be maybe seeing in the future or with other people in your lives. So hopefully you can apply it to your own life too. I just want to make sure everybody is able to learn something. So yes, information is power. Knowledge is power. Education is advocacy. That's one of my biggest things. Education is advocacy. The more you know, the better you can advocate for yourself. So please keep learning. Wait, so strength is not power? No, strength can be power, but so is knowledge too. Because sometimes it takes both. All right. Well, I'm gonna go ahead and do all my shout outs to everybody in chat. Celeste, thank you so much. Divine Fox, Sora, Pegasus, Random Zero, Annika, just a little coffee cat, Lily Bowl. Also, want to thank Yue and Coffee Mom for dropping by earlier. Oh, Tired Cheetah, thank you for joining on the stream. Hi, I'm Riko Siempre, RN, IRL nurse, and VTuber RN educator. I teach about healthcare and nursing topics here on IRIAM and other platforms. I came for kidney stones. Unfortunately, I just wrapped up my lecture and I'm about to head out. However, I will. Thank you for the follow. Thank you so much. However, I will be posting the VOD, if it did record properly, from my other phone and posting it on YouTube. So if you catch my YouTube link, you can probably catch it there. But yeah, if you want to know more, if you want to suggest a topic for me to cover, I'm more than willing to. Just go ahead, give me a message off of you can join my Discord, you can message me on Twitter, Blue Sky, even through YouTube. I got a whole link tree and everything. Just so for any and all of you to ask. So Pegasus, thank you so much. Thank you for dropping by. You all have a good night, and just remember, choose wisely. So use the knowledge that I gave you, use the knowledge that we covered to choose wisely, but live boldly, live your authentic self, live you. All right, everyone. and live bravely. Thank you so much, everyone, for joining me on my stream. I really do appreciate that. You all have a good night. You have a good day wherever you are in the world. And, I only hope for the best. And you all take care. All right? Bye. Bye, my scrubs. Bye. Take care. Good night.